Hello, I'm Dr. Dimitrios Kostopoulos. I am the co-founder of Hands-on EMG Testing and the residency director of the Hands-on Diagnostics residency program in clinical electrophysiology. And I want to thank you for joining me for the next few minutes, where I am planning to discuss with you patient medical management based on electrodiagnostic testing results. So the purpose of the presentation is to help you determine which patients to refer and for what appropriate testing, to understand how the referral process works, to clarify the reporting, which many times can be confusing with the jargon that we use in clinical electrodiagnosis, to discuss some patient management using the diagnostic testing results, and then to discuss the collaboration in the team with you, between you and the team that provides the electrodiagnostic examination. So first, how to determine which patients to refer and for what appropriate diagnostic testing. When you work with our organization, we provide you with information that can help you decipher those referrals. However, before that, let me just point out that electrodiagnostic testing has a great importance in the medical practice. This is a study that was published at the Muscle and Nerve Journal that identified that 51.5% of patients who had a diagnosis before about a dysfunction, when they received electrodiagnostic studies, that diagnosis was modified. It was changed in 51.5% of the cases, and 46.5% confirmed the diagnosis that the patient had. At the same time, in 2020, we published a study that over 462 patients that evaluated the clinical decision making and the patient perceived benefit with electrodiagnostic studies. And what we found was that in over 60% of the cases, the patient management changed because of the results of the electrodiagnostic studies, and 90% of the patients, they felt better able to manage their condition because of the studies. 92% reported very high and high value perceived from the EMG test. So there's a great value, and the idea is how the testing results can help the physician manage their patients more effectively. So also, if you are a healthcare provider who needs to support medical necessity for the treatments you provide to the patient or the interventions you provide to the patient, such as surgical interventions, injections, or other therapeutic approaches, electrodiagnostic testing, neuroultrasound, and musculoskeletal ultrasound can help support that medical necessity. So one of the very valuable forms that you can use in your practice is this diagnostic testing screening tool. This is a tool that we can provide you. If you like, you can implement these questions within your EMR system and within the forms that you give a patient to sign, either electronically or by paper. But very clearly, you can see here that these conditions or symptoms are clear qualifiers for EMG testing, and here would be qualifiers for musculoskeletal ultrasound, and here we have other types of tests such as somatosensory evoked potentials that could be helpful to determine patient pathology. So this is a great form to use with your patients. Step number 2, patient examination and use of guide to refer for diagnostic testing. So the patient fills out the paperwork, you look at the paperwork, and you examine your patient, you do your physical examination. Now, this is a guide to help you identify what type of tests you can refer your patients for. So depending on the symptomatology or the pathology, this guide will help you decide, does the patient need EMG and neuro MSK, or also evoked potentials, or autonomic nervous system testing, or joint MSK ultrasound, and so on and so forth. So this is a great resource. Again, we provide this to you. I will give you my contact information. You can contact me, and we can provide this to you as a sheet that you can have it as a reference guide at your disposal. Then, based on your decision on what the patient needs to refer for, you can make that referral. So let's look at the referral process. There are three options that Hands-on EMG offers to you to make a referral. You can use our referral pad. This is a sample of our referral pad, or you can use your own referral. And of course, we have available for you the www.emgreferral.com. This is a site that will bring you to this form, and you or one of your staff can fill out the patient information. And very easily here, if you click on EMG, you can specify what type of symptoms the patient has and the testing location where you want them to go. And you can sign your signature here and submit it. And that is your referral. We do not need anything more than that. So next, many times we recommend to you to have evidence-based phrases that you can use in your own EMR to substantiate your referrals for EMG testing or MSK ultrasound testing. Of course, you have your own system, you have your own evidence-based phrases. However, we have made this easy for you. And in this website, emgreferral.com, you can very easily click on this link and you can download this entire document that will provide for you several pages for many different conditions, for carpal tunnel, for ulnar neuropathy, cervical radiculopathy, diabetic polyneuropathy, and so on and so forth. You can very easily copy and paste this in your own EMR. That can serve very well as a justification for the service. Then you are going to receive our test results. We proud ourselves that we can schedule a patient appointment within 24 hours from the time you request it, and you will receive within 48 hours the diagnostic testing results. Now, the EMG report is going to look something like that. And yes, I do understand that there is jargon here, such as moderate sensorimotor, demyelinating, focal neuropathic process, that, sometimes I know you would prefer for something much straightforward, much easier. However, this phraseology, this jargon, it is important to fully describe the results of the electrodiagnostic examination. So I will offer you here some explanations, but also I will offer you a very quick solution on what we do for you to help you identify exactly the pathology that the patient has, just looking at our reporting, and even management recommendations. So very quickly, you know that these nerve conditions electrodiagnostically can be classified as demyelinating conditions. We can have a conduction block, or we can have axonal loss. Very simply, in a case of a demyelination, the myelin in different myelin segments in different areas of the nerve has been compromised, and that will create a slowing down of the nerve. Now, conduction block is also a demyelinating phenomenon. In a conduction block, you are going to have such a severe demyelination in a specific segment here, so that when you will stimulate proximally to the block, you are going to have a significant decrease in amplitude. So the amplitude will decrease when you stimulate above the block. So also you can have slow conduction velocity and prolonged distal latency. And finally, we have axonal loss, which is disruption of the nerve axon itself. So the axon is disrupted, and then muscle fibers will start dying out. And of course, we can have collateral sprouting from healthy fibers to the affected fibers, and regeneration, nerve regeneration as well. All right. Now, let's see, what do you do now with that report that you received? Okay, we have created for you, and we provided you with a document that describes the patient condition, what the EMG results generally are, what the ultrasound results generally are, and then with management suggestions and referral suggestions. So, and these are merely suggestions we make. So, for example, we tell you here that in a case of a mild carpal tunnel syndrome, in terms of EMG testing, you're going to see the median sensory nerve conduction velocity abnormal. The MSK ultrasound, the neuroultrasound results will have a median nerve at the wrist cross-sectional area greater than 0.098 centimeters squared. That shows a swollen nerve. And then in terms of management, you can refer to physical therapy, occupational therapy, splinting the patient, or providing non-steroidal anti-inflammatories. Now, if you did make an actual referral to a physical therapist, you can include here, and we have some recommendations for you, for them to perform median nerve neuromobilizations, and of course, home exercise program. So this is some extra information, extra help for you when you make your referrals. Of course, if you have a severe carpal tunnel, again, we tell you what the abnormal EMG findings would be here, and you have the options for injection, carpal tunnel release, and again, post-op physical and occupational therapy. You refer them to a hand surgeon. And we give you the same guidelines for cubital tunnel, ulnar neuropathy at the elbow, and of course for tarsal tunnel, which is tibial neuropathy at the tarsal canal. Same thing for cervical and lumbar radiculopathy, providing you also with information as to when you write your referrals, what you can specifically indicate. In the case of cervical and lumbar radiculopathy, we recommend 6 to 8 weeks of physical therapy, non-steroidal anti-inflammatories, refer for MRI, postural re-education, rest, mild exercise. If unresolved, then of course, epidural to a specialist, or and of course, home exercise program. And we give same recommendations, similar recommendations for different things. Diabetic polyneuropathy, very commonly found, medication treatment, physical therapy, vitamin B6, exercise and nutrition, lifestyle modifications. So this is a general guideline. It does not intend to replace your medical management. These are mere suggestions about what a patient could receive. Please use your clinical judgment for deciding what the patient needs. Now, this is an interesting point where when the patient will receive physical therapy, we provide them with this information to know exactly what to do in physical therapy treatments. Now, of course, for your own use as a physician or other healthcare provider other than a physical therapist, we provide you with this form where, based on our findings, if we find that the case is a moderate carpal tunnel syndrome, we're going to check this off. And then there are recommendations for you for patient management. And when you refer, specific instructions to who you refer if you want to take our recommendation. So this can be also a very valuable tool. And instead of having to look at the very complicated jargon that sometimes we use on our reporting, you can have a very easy indication here where this is a severe cubital tunnel or cervical radiculopathy or a spinal stenosis or diabetic polyneuropathy. Will check off exactly what the problem is. All right. Now, something that I must mention is that the providers who provide testing in our locations, they are either diplomats or residency graduates of our accredited ABBTS accredited program in clinical electrophysiology testing. We are also FELA accredited. That is accreditation from the Federation of Electrodiagnostic Laboratory Accreditation. The people who provide the testing, they have very rigorous training. Actually, as you can see here, a study that was done by Armantrout et al. Found that the EMG reports performed by physical therapists had high compliance rates equivalent to those of neurologists. And Donofrio, who looked at 97 programs, neurology programs in electrodiagnostic testing, those training averaged 22 weeks. Those were PM&R programs, or 4 to 8 weeks, most neurology programs. The hands-on diagnostics residency program is a 3-year program. The residents must complete more than 2,000 hours specifically in EMG testing. They are doing more than 100 one-on-one mentorship hours with a board-certified mentor, 300 graded mentor reports, and they take a vigorous certification exam to become board certified in clinical electrophysiology. So the caliber of education that our staff has is unparalleled to what exists in the marketplace. And definitely utilizing our organization, hands-on EMG testing for your EMG needs. We encourage you to do that. We are an accredited laboratory. We are not owned by business people, we're owned by healthcare providers. So we take responsibility and pride to our diagnostic testing results and our competency. All licensed healthcare professionals, board certified, and we make sure that not only we provide accurate results, complying with guidelines, but also we provide results in a very quick fashion. If you want a more detailed training, I have developed a 6-hour online training in interpretation of clinical electrodiagnosis, and please contact me so I can register you to take this course and obtain that certification. Again, you can use this QR code to refer for diagnostic testing or go to emgreferral.com. And this is my information. I included my cell phone number. I included my email. And feel free to reach me anytime. I hope that this was enlightening and that it helped you get some more information to manage your patients more effectively. Thank you very much and have a great day.